Afternoon, everyone. Thanks so much for joining us today. As usual, I'm going to leave it a couple of minutes for everyone to join. It's not always as easy as you think to get onto the Zoom webinars, so we'll give it a couple of minutes. There's lots of people joining, lots of familiar names, so thanks so much for coming back and joining us today. There is a chat function. There is a Q&A function in the chat. Please feel free to say hello. Let us know who you are, where you're all coming from today, what your jobs are, what you're up to. Always like to hear from people. We've already got Corinda from London. Let us know where you're from. Obviously, use that as much as you like to speak to each other as well. We've got an extra special longer webinar today than we would normally have because there was so much interest in people getting involved with this topic. And I'll go into that a little bit more once we do the intro. So that's a couple of minutes past. We do have quite a few people on already, loads of people saying hello. Thanks so much for all getting involved. Love to hear what everyone's doing and how your day is going as well. A bit of a windy one here where we are, so hopefully some of you might have some sunshine where you are. Okay, well, we'll jump in. So thanks everyone for coming to the Sustainability Partnerships from Patients to Planet webinar. This is the first webinar that we've actually done in terms of biodiversity and rewilding. It seems that this is something that's really creeping up a lot of agendas, not just within the NHS, within the public sector, and with anyone and any business that has quite a lot of real estate, a lot of estates to think about, and how we can actually start thinking about making them a little bit kinder to nature and things around us. So biodiversity isn't just a concept, it's a lifeline sustaining our health and our health of the planet. We rely on biodiversity to stay healthy. So we talk quite a lot about that vicious cycle of the NHS using a lot of carbon within its footprint, and then the health implications, and then obviously more people becoming ill, the more strain there being on healthcare systems. Biodiversity is one of those things that we think about that can really come in and play a vital role to create a healthier and more holistic view of sustainability. We do have quite a few people on today on our webinar, so I'm probably going to stop there because the people that we've invited today have a lot more experience and expertise in this than I do. So luckily for us, we're going to start the presentation with 3 speakers. We've got Dr. Emma Vittery, we've got Rhiannon Studholme, and we've got Liz Hurd. They're going to come on, the 3 of them, give us a bit of a presentation and intro to who they are and what they're doing and why they think that biodiversity is really important. So if you guys want to please come off mute, and Liz, if you want to share your presentation, happy for you to jump straight in. Before you do though, I need to say, and I forgot, the chat function is there for everyone to please say hello, talk to each other, share your views. But if you do have a question, any of our speakers today, use the Q&A function, because I'll be able to, after all of the presentations, come back to the questions then, and we'll go and pose them to the panelists after all of the presentations are done. Okay, so sorry Liz, you go ahead, let us know who you are and you guys want to talk.
And start the presentation. Let me know if you can see this.
You can see it shared. That's at full screen.
Is that all up on the screen? It's there. Fabulous. Well, thank you everyone for coming today. Lovely to meet you all. So today we have a presentation that shares more about a partnership that we've developed between Northumberland Wildlife Trust and a hospital in Newcastle. And it's all about using nature to benefit our health and well-being, and specifically focusing on work that we're doing in a young person's ward in the Great North Children's Hospital in Newcastle. So speaking today, there's myself, Liz Hurd, the Wild City Manager at Northumberland Wildlife Trust, and then joining me we also have Rhiannon Studholme, Eco Mentor at Northumberland Wildlife Trust, and Dr. Emma Vittery, who is a Paediatric Sustainability Fellow at the Newcastle upon Tyne Hospitals and Centre for Sustainable Healthcare. So we'll just start off with a little bit of context for those of you that don't know the wildlife trusts. So Northumberland Wildlife Trust is one of 46 wildlife trusts that exist across the country. And as a movement, we are dedicated to conserving and restoring nature across our regions. So up north where we are, we manage over 60 nature reserves in the region, which is more than the number of Greggs stores. That's an exciting stat. And we work with communities to support nature's recovery. Really critical to what we do is connecting people, especially in underserved communities who might be facing barriers to access to nature or just haven't had that opportunity to experience it before, to build the confidence, the skills and the network so that people all can experience the joy of nature, but also have those skills to act and protect it in the future. So the link between nature and health. So, I mean, all of you here probably have experienced at some point in your life a health benefit of being in nature. And whether that's just being outside in a woodland or a beach and feeling really calm and that your mind is free of stresses. So we've known this for a really long time, that being in nature makes you feel good. But now we have a huge body of research to back that up, and that shows real health links. So, for example, spending time in nature can reduce blood pressure, risk of diabetes, it can increase well-being and perceived happiness, and it can also reduce symptoms of things like PTSD and ADHD, and there's a whole load of other things as well. And as a wildlife trust, we also commissioned a piece of research last year, sort of going beyond those benefits to actually, is there a cost saving to the NHS within that, like a financial value as well? And so we commissioned Ricardo, a consultancy, and also the Institute of Occupational Medicine Health to do a report. And they found that if around 1.2 million people got involved in our nature and wellbeing projects, it would save the NHS 635.6 million a year. So that's a huge amount of money. Although we know the value of nature for health, that doesn't mean that people are accessing that, and there's a big inequity in that as well. So there's something called the Nature Connectedness Index that can measure how people relate to nature and how they feel part of it as well. And Britain within Europe ranks at the bottom of the list for people feeling in touch with nature. We did see over lockdown lots of people getting outside more and gaining those benefits. But since then, we've sort of slipped back into old ways, and there's sort of a stat here about the number of fewer people that are gaining those health benefits compared to 2 years earlier. One interesting stat that we use to shape some of our projects is that in terms of nature connectedness, it's lowest in teenage years. So you can see on this graph here how it dips sort of when people get to age 12 and then lower and lower. It doesn't come back up again until you sort of hit your 30s. So at Northumberland Wildlife Trust, we have put a project together that specifically focuses on working with teenagers. And so I'll hand over to my colleague Rhiannon to share a bit more about that project.
Thanks, Liz. So I'm going to talk a little bit more about Eco-Influencers, which is a youth social action project for young people aged 13 to 19-year-olds based in the north and east of Newcastle. So an eco-mentor, so me, works with identified youth groups and schools to support young people connect and take action for nature in their local community. It takes a youth-led approach. The mentor is there to guide, upskill and motivate the group into thinking about a project that they want to do. And the programme is currently in its 4th year of delivery, and feedback has shown an increased connectiveness with nature and a positive impact on wellbeing within the groups that have been involved in the project. If you move on to the next slide, Liz, thanks. Some project examples of groups I'm currently working with in our local community. I'm working with an African youth group who I'm supporting to create a nature-themed podcast to highlight some of the nature topics that they're interested in, and they want to relay these messages to their peer group. Another group I'm working with is young people who access a local stables, and they're taking practical actions in their local community through a composting scheme. They've got lots of manure, so that's where they fit into the local community, and they want to look to how they can make their stables more eco-friendly. So those two examples highlight the diversity of the youth groups and the importance of the youth-led projects, and that one size doesn't always fit all. So it's really important that we take each group as an individual. We're hoping that we can move this approach and model and adapt it to working in a hospital setting. So I'll pass over to Emma to talk about our collaboration with the hospital.
Thanks, Rhiannon. Hi, everyone. Liz, can I have the next slide, please? So just in terms of context, like Rhiannon said, of this partnership with Northumberland Wildlife Trust, in terms of access to nature in hospital, so we know that a number of the reported benefits of interacting with nature are about being in a, say, a green space or a blue space. But there's also lots of evidence showing that passive or even virtual interaction with nature can have really big health impacts. So, for example, can decrease perioperative anxiety, improve recovery after surgery, reduce pain, and improve satisfaction with the whole healthcare experience. And there's a number of different ways we can do that. So, for example, if the hospital's sited close to a green space, we know that natural light room with a view can decrease anxiety for children in hospitals. There's increasing creation and utilisation of hospital green spaces, so gardens within hospital sites, which is fantastic. And in some cases, that's developing onto horticultural or ecotherapy, although often that's been piloted more so with adult mental health services. And then also we know that young people prefer natural environments and materials for their sort of restorative effects. But as we know, there are lots of challenges in terms of integrating nature into hospital design and practice. So things like location and design of the hospital. These photos are a current and a past historic photo of the RVI site where the Great North Children's Hospital is, and that site was actually re-sited to be next to Leazes Park to recognise that benefit of being next to a park and nature. And then there's obviously challenges of changing hospital design on a large scale. And then the other big thing that I think Liz or Rhiannon mentioned is access. So a lot of these young people, anybody receiving hospital treatment, might face a number of health challenges in terms of accessing green spaces, particularly, fatigue, busy treatment schedules, reduced mobility, pain, etc. So next slide, please, Liz. So that's really where these paediatric bedside nature engagement projects come into their own. So it's building on the fact that we know like diversional activities overall that incorporate particularly play and art have a really positive effect on children's experiences in hospital. And it's again building on that virtual passive engagement with nature to allow a bit more active and sensory connections with nature, but at the bedside for those people who can't access green spaces. And we know that there's evidence showing the benefits of these, even really simple things like bringing natural objects onto a ward for someone to look at, or nature-based mindfulness having the capacity to reduce paediatric perioperative anxiety. And beyond the physical and mental health benefits that we know about, these sorts of specific projects can support pro-conservational behaviours in those young people, and as mentioned, foster development of holistic life skills for young people and sort of wider opportunities. And again, in the kind of context of ecological financial crisis, healthcare services are all stretched. These sorts of things have the benefit that they're scalable, low cost, low carbon interventions, and they potentially have the opportunity, I guess, to use these projects as a micro approach to inequalities and access to nature. So next slide, please, Liz. And we really feel that this sort of project is responding to patient voice. So we know children in hospital, being sick, going to hospital as an inpatient or an outpatient can be a really big stressor for a young person. So that's why it's really important to think about these things within paediatric services specifically. And I think there's a lot of focus on young children in paediatric services, but again, we know adolescents really value nature connection in hospital, and often reasons for this including appreciating beauty and also having a bit of normality in that hospital setting. So the last CQC Children Young People survey showed that under half of young people said there were enough things to do for them in hospital, and again that was mirrored often with parent and carer responses. And nationally from nature surveys, we know that more than half want better access to nature, and a vast majority enjoy being in nature, but more than that, they want to do more to look after the environment. So next slide, please, Liz. So then we wanted to have a look at the staff voice. So we did a survey in our Great North Children's Hospital of about 43 paediatric, mainly nursing and allied healthcare professionals to get their views on this. And lots of people agreed with the statements that nature connection for their patients has the opportunity to improve physical and mental health, which is fantastic. They pulled out loads of different diverse benefits of nature connection, as you can see. And some of the themes were about especially useful for young people with chronic illnesses, with repeat attendance, providing normality, and in the context of our city centre hospital. So next slide, please. We also wanted to give some space for staff to share their concerns or possible barriers to this sort of thing. And again, key themes that came out around staff time and role as to who might deliver them, resources and confidence. But importantly, only one person said that they wouldn't support this sort of thing. So everybody else was overwhelmingly supportive of this sort of project. And there's not anything like this in our trust at the moment. So next slide, please. And when we delved a little bit more into that sort of confidence side, we found that most staff felt quite unconfident in delivering these sorts of engagement activities at the bedside with their patients. And it was great to see that 3/4 were keen to take up further training if offered. So we've responded to that in our project planning, which Rhiannon will come on to. And then next slide, please, Liz. And then a whistle-stop tour of the project planning, just to say that I met our Northumberland Wildlife colleagues at a sustainability conference back September last year, and it's taken since then really to get it off the ground. Lots of scoping meetings, making sure we've got all the right stakeholders involved and support from things like our trust engagement leads. And then we've taken it forward by piloting this project on our day unit and focusing on young people with rheumatological and gastroenterological conditions. And that was partly to bridge outpatient, inpatient settings, and also because some of these conditions that are immune driven have an independent association with deprivation. So we thought they were a really good target for this project. So I'll hand back to Rhiannon to tell you how the project's going.
So as Emma said, we're in quite early stages of the project still on the ward. So we're currently exploring young people's ideas around what they want to do as a project with it being youth-led. We do that via gathering information via a starter form. That's completed by the young people at the very beginning of intervention. So alongside that, we've been running some fun nature-based activities just as like an introduction and to spark interest, as well as sort of gaining environmental knowledge along the way. An interesting point that's come through on the starter forms, even at this early stage, is that young people recognise the importance of happiness and nature, and they connect that themselves, and they rate it quite highly on the importance scale. But unfortunately, also the scale themselves is very low or lower in feeling currently connected to nature. So we're hoping that this project will increase that. Yeah. Next slide, please, Liz. So the plan for the project is that we're running a 2-month pilot to see if it can work. And we're hoping that that'll extend through to a 6-month project. And alongside the young people deciding on what project they want to do in the hospital, is we're going to try and develop some nature resources that can be adapted to the hospital setting. And alongside that, through reflecting what was said through the staff survey, is that the staff need training in respect of those nature resources as well. So we're looking to support that. And finally, we're looking to explore links with the hospital arts department to make links with the wider local community and feed into other projects that are happening, because there's huge benefits to making lasting links for the longevity of a project, as well as widening the experience for the young people. So we'll look forward to trialing it. And I think the early indication is that the young people really want this on the ward, as well as their families, through comments that they've made. So yeah, looking forward to the next 4 months. And yeah, thank you for your attention. And I think Liz has put a slide together at the end with some links to reports that have been referenced throughout our presentation.
Thank you guys, and thanks so much for sticking to time as well. We normally don't run so smoothly, but that was a really great presentation from all of you. I love the stat around more nature reserves than Greg's. That speaks volumes, especially in the Northeast. I love the fact that we're doing with this with people from a young age, especially with those stats around the adolescence and losing touch with nature. It's really important for people to feel that that need to be part of nature, and it really does start from a young age, doesn't it? Love to see that things have been moved next to Leazes. I used to live next to Leazes Park, so I know exactly how beautiful it is around there in Fenham. So really happy to see that you guys are doing that. I've got some questions. There's some questions coming in, so really happy that everyone's really engaged. Really great to see everyone just saying hello and dropping who they are and telling us about what the weather's like where they are as well. Let us know how it's going for you guys. We're going to move straight on to you, Hattie, if you can please share your slides. There is a question here about the slides being available. They will be available with our write-up, which will be going live next week, along with the video that you can rewatch from today's session as well. So Hattie, please let us know who you are and what you're going to be going through with us today.
Oh, yeah. Hello. I'm Hattie. I work for the NHS Forest, which is a project part of the Centre for Sustainable Healthcare. Thank you for having me today. I'm hoping just to give you a bit of a snapshot of the work that we do, and to share some information about our tree planting scheme, show some case studies which demonstrate biodiversity benefits as well as patient benefits, and then I'll mention a little bit about our ICS mapping project, which is in its early stages, as well as talking about tree equity a little bit, which we had some input on. I'll cover quite a lot, so I will put links in the chat at the end, so don't worry about that. Great. So the NHS Forest is a project, as I said, it's part of the Green Space team at the Centre for Sustainable Healthcare, and our main funding is around tree planting at the moment, which is how I'm funded, but our work extends beyond trees. For example, we've got a Nature Recovery Ranger programme, and we provide training through webinars. We're also involved in research and policy work, and not mentioned on the slide, but we've recently started a volunteer matchmaking service. So we found that with the tree planting, there's been a need for sites to find volunteers to help them with their tree planting. So we've started this kind of matchmaking service. So if you are looking for volunteers, that's really good. But also if you're a volunteer looking for places to go, you can kind of register for alerts for that. On our website, we've also got the NHS Forest Network, which is that map on the left there, and that's kind of an interactive map that shows hundreds of examples of healthcare green space projects, and can give you kind of contact links to people doing those there. And it's got loads of examples of kind of therapeutic gardens, nature trails, orchards, and it's really worth having a look at to see if there's something happening at your site already or within your area. Where plant trees, already mentioned by the ladies previously, but there's loads of benefits from being close to nature. There's studies that show there's direct health benefits in a healthcare context to having a view to trees, and it can speed up recovery times. But there's obviously indirect health benefits. So trees provide good ecosystem services, they filter air pollution, they provide shade, and they help reduce flood risk. And these kind of ecosystem services were a key motivation for our tree planters from last season. So trees and access to nature have a greater effect on groups' experience health inequalities. So urban NHS sites are really important for improving that green space access. Financial benefits, surprisingly, the forestry research report, which was published at the beginning of the year, looked at 4 NHS sites with woodlands and assess the monetary value of these trees and woodlands, and they found that on average they saved £80,000 per year just on kind of carbon sequestration, flood prevention, and those kind of air filtration benefits. It didn't even start to look at like the human benefits of having access to green space. Lastly, staff wellbeing. We we published a report called Space to Breathe, I think a couple of years ago, and it found that staff who had spent time in nature at work reported significantly higher levels of well-being than those didn't. And 50% of staff said an attractive green space was really important to them in considering where to work. So potentially a factor in recruitment and retention. Quickly, last season we planted over 27,000 trees across a lot of sites, and I thought it was quite interesting to see that the majority of people, the most common reason for planting trees was to provide habitat for wildlife and biodiversity. This is a really nice before and after example. This is Tick Hill Road Hospital in Doncaster, and they planted a lot of trees over kind of a broad, a big site. But so you can see that they've kind of got examples of planting little woodland copses to break up a playing field, and then also kind of filling in gaps to maybe create hedging, or just, gaps between hedging and trees. So, and created zoned areas around those kind of buildings in the background. So there's lots of ways you can plant trees in the healthcare site. So I'm just going to talk through a few case studies now. The NHS is incredibly varied, as you know. So these case studies are all people who've planted trees with us last season and intend to plant some more next season. So this is Langdon Hospital in Devon. It's a secure mental health site that has used tree planting for occupational therapy. And they've recently started integrating, so they've recently started integrating conservation work into their patient program. So it was previously, they had a woodwork department, but they've started taking like kind of woodwork and skills-based stuff outside. They started restoring a Devon hedge as part of their care, as part of this like care pathway, and then during this project discovered a veteran orchard that had completely been overgrown with brambles and brush. So they decided to clear back the brush, and they made this dead hedge, which is the picture on the right. These are great habitats for nesting birds and small mammals, and they've actually seen hazel dormice nests in these dead hedges. So and that's a very rare mammal. But they've also set these wildlife cameras. So that was pictured. The hazel dormice was found on the camera, but also this is like a badger that's been seen. And they project this inside to the hospital or the NHS site, and so you can bring the nature inside to people who can't necessarily go outside. On site, they've also introduced a green path called the buzzard path, and one elderly patient who was really resistant to any therapy has developed a keen interest in bird watching, and now kind of talks to everyone about what he's been seeing on his walks. So secondly, Abbey Fields Medical Centre. So this is just up the road from me. I'm in Colchester. This is a very urban medical centre. It hasn't got a lot of green space, but they've managed to partner with an organisation called Abboton Rural Training, which provide kind of horticulture and countryside management, carpentry courses across multiple sites. And they've partnered to kind of develop this green space in the best way that they can. And they've introduced raised allotment borders. They've put some fruit trees in. They've built outdoor shelter for meetings, and then also a tea shed, which is what you can see in that lower picture. And these aren't just for the trainees, it's for staff and patients. So it's encouraging people from the medical centre to get outside as well. The trainees who work on the garden together can decide if they want to get an NVQ level in horticulture, which is awesome. So I think it's a really amazing partnership that helps NHS sites also see from the benefits of social prescribing, because a lot of these trainees are social prescribed this work, but also having their green space improved. Last case study is Pinderfields. So Pinderfields have made some really drastic changes to the way they manage their grounds. It was previously kind of close-cut mown grass fields, but since 2022, they've left 10 acres of grass to just become meadow. And with no seeding whatsoever, 50 species of wildflower were recorded. And these parcels of land are not mown until later in the year, so in September time, and this allows it's not just no mow May, it's the full it allows the full life cycle of the insects to kind of complete. And this practice has been really successful and has continued year on year. They received a few trees from us, and they've kind of they've been working on taking out laurel and snowberry, which are both varieties which are kind of ornamental but not necessarily good for biodiversity. And they're replacing those trees with, or those plants with native broadleaf trees, which are better for local biodiversity. And they're also working with frog life to plan out a wildlife pond, and yeah, they've just got some great stuff going on. So there's a lot of potential in NHS sites. Very quickly, our tree offer this winter, we've got tree bundles, which are all kind of themed based on what sites need, but we're also looking for sites who want to do woodland creation. So this is for 300 trees plus, and if you order that many trees, you would then have access to larger trees. So the majority of our trees are these width, so what you can see in that box that Alexa's received. But we do have access to the larger trees as well. So we also have fruit trees. These are also larger, so between 1 and 2 meters, and they're going pretty quickly. So orchards used to be a really common feature in hospitals, and they're fantastic for biodiversity. So we're really looking forward to kind of reintroducing that. And alongside that, we have some training with the Orchard Project. So lastly, tiny forests. We're working with Earthwatch to find a few sites to install tiny forests. That's in the picture on the right. So these are pocket forests, 600 trees in the size of kind of a tennis court. So really densely planted, multi-layered kind of planting. And yeah, so if you're interested in that, we need applications as soon as possible, really, because they take a bit longer to plan. So yeah, I'm going to talk about tree equity score now. So we were involved with this alongside the Woodland Trust and American Forests. So they had a similar one in America, and they brought it over to the UK. And it's basically an interactive map, and you can see the difference between existing canopy cover and canopy goal. So canopy cover is how much tree cover and shade is there. It was also adjusted to these priority indexes, so these 6 factors, and it creates this score that indicates where would benefit the most from having increased canopy cover. So this is just a screenshot of Sheffield. Orange indicates an area that needs improvement, and green indicates it's got a high tree canopy cover already, so it's kind of all right. And we've been using this map to identify NHS sites which have land which have a low tree equity score, but also have which have land but also have a low tree equity score, and therefore would benefit most from tree planting. Lastly, my colleague Dan, who unfortunately couldn't make it today, is working on some mapping of like an ICS level mapping to identify areas for tree planting and other habitat creation opportunities that could, you know, link up healthcare sites to ancient woodlands and create kind of wildlife corridors. So connecting the NHS site to the wider environment. And then this is happening in Dorset, Cheshire, Merseyside, and Greater Manchester. That's all for now. I'll add some of those links that I've mentioned in the chat, and I'll pass back to Georgia. Thank you.
Thanks, Hattie. So great. 27,000 trees. It's a big number. And I love the fact that you're showing the live feeds internally as well, because it's all about engagement, isn't it? We can talk about, well, we've done all these amazing things, but unless you're engaging with patients and staff and visitors and actually showing them in a real way that makes them feel connected, there's not like a lot of point in doing it unless everyone's involved. Great to see that you're removing those ornamental and varieties and for indigenous trees as well. I think that there was an obsession with laurel in the 90s. You see it on a lot of housing estates as well, where there's just laurel everywhere because it's good for sound, I think, protection, but then it's not good for our native biodiversity. So could talk about this for a long time, but we do have more people that need to be sharing their insights. So we've had some really good news stories so far, really inspirational stuff. But I think that luckily we have Gemma, who's going to come in from Sweco to speak to some of you about maybe where you can get started on some of this stuff. So Gemma, do you want to give us an intro to who you are and what you're going to share with us today, please?
Yeah, sorry, I'm just sorting out my screen share. Oops.
That's it.
Right, there we are. Hi. Yeah, so my name is Gemma Lineker and I'm a principal ecologist working for Sweco, who's a company who do consultancy and a wide variety of things and engineering, etc. So one of them which is ecology. And I'm just going to talk about ecological constraints, so more about thinking about what's on your site currently and then what you might need to do about it if you're doing any works or anything further at the sites. And so then building on that, when might you need an ecologist's help with something at your site? So I'm just first of all going to talk about the role of an ecologist, what we do, when you might need us, some ecological constraints, and then I'll go through a couple of case studies. So first of all, the role of an ecologist. So what do we do and why and when would you need us? So we really do a wide variety of things, and it's really anything that a client or somebody comes and approaches us needs. So that's a lot of the time that's providing advice, it might be providing surveys, reports, but really just anything that's needed by a client. And it's generally relating to mainly legislative compliance. So there's certain legislation which means that certain things would be an offence relating to animals, habitats, etc. And so our main function is to make sure that our clients are doing everything within that legislation, they're not committing any offences and everything's being done properly. The other big one is a planning. So anything that requires a planning application will need some ecology input, will need some surveys to be done just to make sure that that development is not having an impact on ecology. Another thing that we get asked to do is things like selecting sites and due diligence. So somebody might want to know what might be at their site in terms of ecology, and so whether, depending on what they want to do with it, that might be a good thing or it might be a bad thing. If you want to develop it, it might be that you find that your site's not actually going to be a great one for development because it's got a lot on it, or it might be that if it's a good site, then somebody might want to know how they can make it better. Here's a list of the main services we provide. I won't go through all of them in detail, but it's just to give you an idea of the sort of range of things that we do. A lot of our work is something called a preliminary ecological appraisal, and this is where we go to a site and we just assess what we think the ecology value of it might be. So we'll do a desk study looking at what's been recorded in the area, what might have been recorded on the site. We look at what habitats are on the site and also what species might be living there, what might be on the site. And then a lot of our work is doing actual surveys, so going on the site, surveying for botany and species in particular is the main majority of what we do. We also do mitigation licenses. So if you need to do something on your site which would cause an offence, then you'd need a mitigation license in order to be able to do that. So an example, which I'll talk a bit more about later, is if you've got a building with bats in it, you need to do some works to that building. You might disturb the bats that are in the building, which would be an offence. So you need to apply for a licence in order to be able to undertake that work. And we can help with that. We can do all the paperwork, work out exactly what you need to do to make sure you're not committing an offence and doing everything that's needed. And then we write assessment reports. This will be relating to planning applications. We'll also write method statements. So how can some work be done to make sure that you're keeping within that wildlife legislation? So if you need to clear some habitats, making sure you're doing that in a way that is helpful to the animals, make sure you're not committing those offences. We also get involved in BREEAM. For those of you who don't know what BREEAM is, it's to do with getting credits to start doing certain things linked to sustainability to a site. And there's a section about ecology, and that's all about providing habitats and improving habitats and making sure you're not taking away good habitats. So it's linked to planning generally. There's also a new thing that's been brought in this year called, which is biodiversity net gain. And now all planning applications have to show that they're having a net gain for biodiversity. and this is done through completing some calculations which look at the habitats that are going to be on site now and after. So we do that and we look at reports. Another way that might be relevant to people who have got NHS estates to look after is that you can also sell credits for biodiversity net gains. So if you're creating some nice habitat on your site, then you might actually be able to get some money towards managing that, creating that habitat, because there might be a development somewhere nearby who needs to create some habitat, doesn't have the space for it, and so they can look elsewhere to get that done for them. So that's something to think about, relevant to some people who might be on the call. We'll also write ecological enhancement and management plans. So how can a site be made better for biodiversity, and how can you achieve that? What do you need to do on the ground to make that happen? So this is just, I won't dwell too much on this, but this is the pieces of legislation that are important when thinking about ecology. So the main two are the Conservation of Habitats and Species Regulations, which is a European piece of legislation. And then there's the Wildlife and Countryside Act, which is the UK piece of legislation. And then there's various other ones which come into play depending on what's actually at your site and if you're going through planning, etc. Another one which might come up is the Protection of Badgers Act, because badgers are protected separately and in a different way, which I'll talk about a little bit more later. And obviously the other big one is planning policy. It's making sure that if a project goes to planning, are you satisfying all the policies relevant to that area, and to just generally to ensure that the plans will get through. In terms of when do you need an ecologist, I've sort of talked about in what situations you might need an ecologist. So it's generally relating to if you're doing any works, any planning, anything on your site. But when in that process should you engage an ecologist? Well, my answer would really be as early as possible. This is because a lot of the surveys can only be done at certain times of the year. So if you think you might have bats in your building and you come to us in November, we can't then do the survey till the following May. So if we'd been thought about earlier, we might have been able to do it earlier that year, as an example. The licenses can take a long time to process. So if you're doing some works and you need a license for that, we've got to write the license, then it goes to Natural England, who are the government body who sort out the licenses. They take a while to look at it. They might come back with questions. All of this just takes time that could cause delays. So obviously the earlier you can get this work started, the better. Mitigation might need to be built into works or design. So if you're doing some works at your site, you might need, and you're disturbing something like a bat roost, you're going to need to replace that bat roost potentially. If you've got a large site and you're taking away habitat, you're going to need to create some habitat elsewhere. So it's just making sure this is considered early enough so that that can be thought about when designing the works and working out what needs to be done. Also, if people start doing their works without getting an ecologist in early, sometimes they find something when doing the work. So this happens to us with bats. We get somebody calling saying we're doing some works on a building, we found a bat, and then the works actually have to stop. We have to go, we have to work out what's going on at the site, what bats are there, then we've got to apply for the license, we've got to get the license through, and so that can have a real big delay in a project. So it's definitely better to think about these things beforehand rather than just see if it happens when you're actually doing the work. So now talking about ecological constraints. So these are what ecological features need to be considered, what things are covered by that legislation, what might be on your site that you need to think about. So I've mentioned it a few times already, bats is a big one. So all UK bat species are protected, and this is from killing and injuring of themselves, but also disturbance if they're in a place of shelter, and also the destruction of those resting places and breeding places. So it's, if there's a roost on a site, destroying that roost could be an offence, and also disturbing bats while using it can be an offence. So if you need to do roof works on that building and the bats are in there, then there's a chance that you might commit an offence if you've not got the proper licenses in place. So yeah, this could be covering things like works to buildings and also trees. So in the next slide, I'm just going to show there's just a few examples of where bats might be. So it's not just, I think people think about the bats hanging in big barns and things, and that is some species of bats, but there's other species of bats like pipistrelles who will go in tiny little gaps that are in mortar or underneath a roof tile, just really small little areas, and they just kind of fit themselves into very small spaces. So that's something to think about, as well as kind of actually in roofs voids and lofts. They also go in trees. So if you've got a tree that's got woodpecker holes or rot holes or any gaps in the tree, then it's possible that there's bats living in there. Another big one that's relevant to all sites really is birds. And this is because all nesting birds are protected when breeding. And this even includes kind of pest species like pigeons and gulls and things, which people might think of as being pests. They're still protected while they're breeding, so you still can't destroy their nests while they're breeding. And there's also some other certain species of birds that have even further levels of protection, and these are ones that are particularly rare, things like barn owls and kingfishers. And then there's just a bit more protection, a bit more restrictions on what you can do in terms of disturbance, what times of year, etc. And birds can nest everywhere, really, anywhere. So it can include things like grassland, buildings, in trees, scrub, also construction sites. I've been called out to sites where I've had pigeons and pied wagtails who have built nests in sort of buildings that they're starting to build, so completely open to the elements. Just they'll find any space and they'll go in it, and they don't seem to be too worried about people. This is certain species, obviously, that live in urban environments. If you've got a lot of space that might be being used by a lot of nesting birds, then you might need to restrict when you're doing works. So they might need to be outside the bird nesting season, which is generally March to August. This can vary, particularly things like pigeons in buildings won't necessarily adhere to that. They'll often can be nesting all year round, but most species will be generally in that window. If works do need to be done in that period, we can sort of come and do a survey and just check that there's no active nest there, or if there is a nest, try and confirm if it's being used or not, and then determine if the work can progress. But if you were clearing a large area of very high quality habitat, like a huge hedgerow or scrubs and things, it's better to do it outside the nesting season. Badgers, we saw a picture in an earlier talk of a badger at a hospital site. They're protected not for their conservation value. So other species that I've talked about are protected because they're rare or declining, but badgers are different, and this is linked to badger baiting. And so they're not protected for conservation value, it's just to protect them from cruelty. But this does mean that if you are doing any works near a set that might damage or disturb a set, it needs to be thought about, because that's still illegal. It's not just about badger baiting, it's just any sort of impact on the badgers while using their sets. And badgers can build sets in a lot of places. They can even be in fairly urban areas. The best places they like are usually things like woodland and hedgerows and embankments, but they can pop up in some surprising places as well, as long as there's somewhere for them to dig their sets. Some other protected species that we deal with a lot, but might be a bit less relevant to NHS sites, unless you've got, some of the sites might have large areas of different habitats, but for mainly urban areas, it's probably the ones I've talked about already are probably the most likely to occur. But just to make you aware of some of the other species that have legal protection. There are certain plants, so example here is bluebells, but there's also certain orchids, there's a list of other ones. There's great crested newts. All species of reptile in the UK are protected. So the main common ones are common lizard, slow worm, adder and grass snake. We've also got mammals like water voles and otters and hazel dormouse, which was also mentioned in a previous talk. Another big one that's sort of relevant to any site really, particularly urban sites, is invasive species. Now, Schedule 9 of the Wildlife and Countryside Act makes it an offence to cause any of these species to spread. So if you have any of these on your site, it's really important to know what they are, where they are, how they might spread, and just to make sure that they're not disturbed in any way, that they're not, if you are managing them, if you are trying to eradicate them, you're doing it in a way that doesn't mean that you've spread them around. Because, for example, Japanese knotweed, you only need a very small piece of it and a new plant can sprout up. So it could be transported on someone's shoe to another site, and then technically that's an offence. So it's just need to be really careful with some of these species. So species on the list include things like Japanese knotweed, which is what the picture shows, giant hogweed, Himalayan balsam and rhododendron, but there's a very long list of these now, and it gets added to lots of plants that live in ponds and things like that and along watersides, but these are kind of the ones that I think you see the most in sort of built up areas. Just some other things to think about that might be a bit less relevant to a lot of people on the call, but just to point them out, is protected sites. So things like sites of special scientific interest, Ramsar sites, local sites. There's certain habitats that are quite rare and priority habitats. There's fungi communities, and there's also invertebrates. So there's certain individual species of invertebrates, or if you've got a good diversity of invertebrates, this can also have a constraint on, mainly for if you're doing a big scale kind of development or planning scheme. So timing, I talked a bit about birds and bats and having to do surveys at certain times and works at certain times. There's these sorts of timing restrictions on nearly all species, and they do vary a bit depending on certain times of the year when they're the most vulnerable or when they're the most detectable for surveys. And you probably can't see it that well here, but I can give you the link to this if you want to look at it more closely. But we've got a calendar that kind of shows what times of year you can do different things for different species. Just to run through a couple of case studies that we've done on NHS sites. So the first one is a bit of a smaller scale, and this is the Ipswich Hospital Urgent Treatment Centre. This was creation of the new UTC in the existing hospital site. So it was on an already developed site. We went and looked at the site, looked at what species it might support, looked at whether we thought the buildings might support bats, etc. We found that it was only really nesting birds that needed to be thought about on this particular site. So the services we provided was this initial ecology appraisal, so what might be at the site. We did an impact assessment report for the planning application. We helped with the BREEAM credits, and part of the BREEAM and just generally for the hospital was producing a landscape and ecology management plan to show how they can manage the habitats that are on site at the moment, and also any new ones that they were creating to maximise biodiversity. A bigger one that we were involved in is West Suffolk Hospital, and they're planning on constructing a new hospital in a site, so there's no development there at the moment. It's quite a nice site, quite a lot of different habitats on there. So for this site, we did our initial walkover, and then we needed to do a lot of surveys just because the site was suitable for a lot of different animals. So we did badger, great crested newt, reptiles, dormice, bats, fungi, detailed botanical and invertebrate survey. So quite a large number of the different surveys we do needed to be done on this particular site. We then had to do a report for a biodiversity chapter for an environmental statement, which is generally on bigger sites that are going to have a lot of potential environmental impacts as well as ecology. And we just did the ecology part of that document for planning. And we also did some engagement with stakeholders, so people that were interested in the project wanted to make sure that it was going to benefit diversity, wasn't going to result in a loss of an important area. And this included with representatives from the council and the Wildlife Trust. Sorry, excuse me. So just a quick summary of what I've talked about. So if you're doing works that require a planning application or may cause an offence under nature legislation, you'll likely need an ecologist to help you with those works. An ecologist can undertake the surveys, we can provide the reports and or get the licenses that you might need for those works to go forward. You should ideally seek advice from an ecologist early on in the project just to avoid delays and ensure that you've got the space for any mitigation that might be needed. And ecological constraints to work include species such as badger, birds and bats, but also invasive plants and protected sites. And the ecology that you've got at site might affect the timing of when works could be conducted. So that's everything. Thank you.
No, look at that. Keep that. Thanks so much for that, Gemma. If people didn't know what an ecologist did before, now we've got a much better idea. So thanks so much for that. I've got loads of questions for you, but hopefully we'll have more from others in the Q&A as well. That calendar, I think, will be super helpful. It's definitely a resource that we'll be able to share with everyone. I've always heard of great crested newts, but I've never actually seen one, so I'm glad to know what they actually look like now. Matt, you're going to let us know what you guys are up to in the next session. Then we are going to go into some of these questions that people have got. Loads of great questions. I really appreciate them. Sorry, one of which is yes, I will send all of the links and all of the email addresses and all of the things that are in the chat. I'm aware that you guys can't share what's in there, so either click on things and share them now or wait until I write up next week where all of the resources will be in one place. Sorry, Matt. no more delays. Please go ahead, let us know what you do and what you're going to be talking about today.
Cool. Thanks, Georgia, and yeah, thanks to the other speakers as well. I'll just quickly share my screen. Hopefully everyone can see that okay. Oh.
Not yet, Matt. We'll let you know. That's it.
Okay, great. Yeah, so yeah, basically, my name is Matt Lindsay. I'm one of the directors at Growing Revolution. We're a company based down in Sussex, and we specialise in living walls and other green infrastructure products. I'm sort of here to talk a little bit more about sort of the benefits around green infrastructure as a sort of a whole, and also more about sort of providing living wall sort of solutions across the NHS estate as well, and sort of talk about the more holistic benefits around urban greening as well. So if I move on. So a little bit about us. We're basically, well, we're a very small company based down on the South Coast. One of the key things that we're always talking about doing, and one of the key things that we always sort of prioritize in what we do is to make this sort of positive difference. And I think it was Gemma talking about BNG and biodiversity net gain and everything else, and making a sort of a measurable positive difference to what you do. And that's one of the key things that stands out for us. And we try and sort of bring nature closer by sort of creating these sort of green interventions across our cities and towns, but also across sort of public and private spaces too. So the sort of the photo that you can see on the screen there is of the Canary Wharf estate in London, where there's over 700 square meters of green wall that recently went in a couple of years ago. The other things are all around sort of creating sort of confidence in what we do, so sort of education, so talking to other people about what we do and sort of delivering this sort of service to our customers and clients, as well as other sort of educators and facilitators around, which can also sort of have a understanding of what we do. Because I think a lot of the time of what we do is spending time talking about sort of the benefits of living walls and green infrastructure, and what it can do for different sites. And I think there's a lot of confusion and complexity in years gone by, and I'm sort of here to sort of demystify living walls a little bit more. The other thing is we're very sort of keen on being a sort of an innovative, research-driven business that's always trying to create sort of nature-based solutions that are good for people and place. So that's the sort of the four things. I'm here to sort of talk about a little bit about biodiversity in what we do. Of course, there's a sort of a myriad of other sort of benefits and pluses that sort of are attributed with living walls and green walls. You know, such as improvement of air quality, rainwater attenuation, noise absorption, all that sort of stuff. But of course, biodiversity is also at the heart, and it's a very sort of natural addition in terms of what we can sort of promote and produce. We work with a number of different clients and customers and partners as well, including the RHS and people like the Eden Projects as well. This is a quote from Andrew Salisbury, who is the head of plant health there at the RHS. And he basically talks about green walls and their sort of their role in sort of delivering and increasing biodiversity. So there's all sorts of different sort of plant species that can really sort of, well, things like invertebrates and beetles and springtails especially are very much sort of key species in there. But there's a variety of different plants that have different benefits and different sort of different ways in which they can sort of create to an amazing sort of green wall. I know Gemma in the previous talk there talked about BNG. I won't talk too much about it, but I will talk a little bit about sort of how living walls aid biodiversity. And one of the sort of obvious ways, I suppose, is the sort of the additional green surface area. So instead of having that sort of horizontal plane of soft landscaping maybe in a public development or across an NHS estate somewhere, you're not taking up sort of precious ground level space for other things. You're really making the use of that vertical space, and that tends to mean that you have that sort of well, you have a way then, which is a lot more interesting in terms of adding different plant species in there, which of course have other benefits to attract and increase biodiversity. The other couple of things that also happens as part of this is that because the way that green walls are sort of installed and everything else, they're very rarely go out sort of without being in a sort of semi-mature or mature stage. So what that does is create an instant habitat for bees and insects and butterflies and everything else, where they've been sort of grown on either in a nursery environment or in situ somewhere. They also act as green corridors, especially sort of in the sort of the built environment, urban sort of setting, which is interesting. And then a lot of the sort of projects that we've been involved with recently has always been sort of using a sort of a standard plant palette, which is made up of sort of 7 or 8 sort of key species. And they're tried and tested on different aspects, depending on whether it's sort of shady or sunny. And what we're getting asked for a lot more now is for native planting. So the introduction of native species across our green walls, which are then complemented by this sort of other sort of standard what we call matrix of plants, which create a really interesting sort of aesthetic as well, which is the other, I suppose, benefit of what we do. So there's the BNG side of things, and this is basically what I was talking about as well. This one's from the University of Cambridge, where they sort of talk about this variety of planting, and the sort of the unique combination, and I suppose the site-specific nature of what we do allows for us to put plants in spaces that necessarily weren't thought about as being sort of a haven for wildlife. And as particularly, in urban areas where there's, issues with air pollution and I suppose ground space as well. Green walls and living walls are the sort of a really good way of introducing that nature to that space for benefit of people and also the site. Here's just another example of what we've sort of been up to. This one's at Hertfordshire Zoo. So I'm not saying this is relative to some of the NHS sites that I've seen, but this sort of thing is really important and becoming really popular as well. So there's a sort of habitat tower, and that's sort of wrapped around a sort of a living wall that we've provided, and then it's sort of capped off with a green roof on top, which is great. And it's these sort of interventions, I think, that really do play a big part in increasing that biodiversity across estates. And I'm really an advocate for sort of pushing this, and a lot of it sort of stems from policy as well, in terms of budgetary restraints and all this sort of stuff. But I think the more I'm sort of talking to people about this, and the more sort of education there are around the different types, I suppose, of green intervention that are possible, the more widely things like this will get specified into plans. So here's another thing. It's just basically, again, recapping what I was saying about the sort of the space element, and it's providing sort of that ecological value to pollinating insects and invertebrates and everything else, but allowing them not just to sort of as a place to sort of bed in and everything else. It's a place for them to thrive year on year. And some of the plants that we do specify, or in fact all of the plants that we do specify, are ones that don't need much in the way of maintenance and sort of ongoing care. Of course, things like irrigation is all a part of this, which I'll talk about. But overall, it's not stuff that needs replacing out or is very high maintenance at all. It's very sort of low maintenance and sort of easily sort of, I suppose, easily specified into plans and drawings and everything else, which we've got. Another couple of examples here, and also a study as well, which we've come across. And obviously, I was talking about the sort of the wealth of benefits that green walls and living walls have to people in place. But one of the most important and sort of, I suppose, interesting studies that came through was a study which was done over 9 years in Pennsylvania, and it was a sort of a 200-bed hospital. And some of the sort of highlights of this was that the sort of the view of a brick wall versus the view of nature, and that sort of that room with the view that I know a couple of the other speakers were talking about, also does have that measurable return on investment for the NHS as well. And we're talking about sort of average time in hospital. A view of nature. Patients were sort of seeing 7.9 days in hospital, as opposed to a view with a brick wall of 8.7. So there's almost this sort of restorative healing effect, which is I know being researched even more thoroughly at the moment. And also sort of weaker pain medication as well. So there's this sort of I suppose psychological wellness benefit as well to just looking at nature and being around nature and sort of seeing green instead of grey. Of course, there are some limitations in terms of specifying green walls and living walls across sort of hospital environments or sort of clinical environments. We would primarily see these sort of installed across exterior facades, courtyards, that sort of areas, but also places like waiting rooms and atriums as well, to create this sort of sense of calm. I mean, a good example, not sure if anyone's been, but at Heathrow Airport, I think it's Terminal 3, Gate 25, it is a good example of where we've installed some living walls across sort of the waiting area. And it's the last place that people actually sit before they board a plane. And of course, if you're an anxious flyer or have some concerns or whatever, the area where you're sort of sitting has no natural light whatsoever. But what this sort of green intervention does and what these sort of living walls do, which are dotted around, really do sort of make a difference. And that was actually measured in a study, which I can share. We also talk about sort of the wider benefits, so not just sort of biodiversity, but also this sort of spaces, people and business. So we're talking more around sort of the air quality, so things like nitrogen dioxide and VOCs for indoors, and also particulate matter, which are all pollutants that can cause respiratory and other issues, and obviously plants, the power of plants can help to reduce this, and we're actually working on some other interesting product ranges which are all around sort of active air and this sort of like this active airflow, which is all around, I suppose, phytoremediation and the sort of the removal of pollutants using plants. So watch this space on that one. The other thing is around sort of acoustic benefits. And this thing of making a better place for people to live and work. Excuse me. I appreciate I'm skipping through these, but I'm conscious of time as well. Again, just some sort of recap, and I appreciate how visual living walls are as well. It's sort of an aesthetic benefit that we talk about. But here are some examples and some case studies that we've sort of been working on. One at the top left is in Cundy Street, which is in Pimlico in London, central London. The second one is a construction hoarding, which I believe is being just used for a sort of a hoarding at the moment, and it's going to be reused on the building itself when it's complete. Excuse me. And the final one is also on another construction hoarding, which features habitat boxes built in. Excuse me. So this is the product that we have come up with. It's a clickable and stackable living wall system. It's very simple and straightforward. It's all made in the UK from 100% recycled materials. And basically what happens is water tracks into the top of the living wall, fills up a reservoir which is built into each trough, and then excess water is drained from the top trough into the one below and keeps going all the way down. And what happens, plants are then planted into sort of the main trough, and water is absorbed up through a capillary action or wicking fabric to deliver plants that can thrive, basically. So it's a very simple and easy system. Excuse me, I've got a bit of a cough going now. In terms of the sustainability of it, it's very important for us to have products that are locally made and locally sourced. So we always sort of refer to the fact that all of our materials are UK sourced, and it's all made from recycled materials. We also donate 1% of our sales to environmental causes through 1% for the Planet, which is an initiative that a few of you might already be aware of. It basically reinvests into other initiatives worldwide that can improve things like water quality and air quality. Not talking obviously biodiversity, but here's an indoor living wall that we've been involved with up at RHS Wisley. This was part of the Hilltop development as part of their new science centre, and it's got a lot of information about sort of the benefits of and plants and sort of their impact on air quality and the benefits of that in terms of how people are benefited through green infrastructure. So that's the sort of a Nature for Good campaign that we're sort of working and pushing towards as well. And it's through our partners, people like the RHS and the Eden Project are big sort of champions in terms of pushing what we do. And I find it's all about sort of talking more about the benefits that can really sort of make these happen. And we can hopefully see more of them overall, really. Here's another quote, just around sort of the future of healthcare design. So very relative to the RHS and some of the facilities managers on this call, is all around sort of introducing more greenery, again, into those non-clinical spaces, which then introduces more life and more healing through sort of the power of plants, really. And like I said earlier, because you're sort of not taking up the sort of the valuable floor space and ground space, you're really maximizing the amount of plant coverage and creating these habitats and places for wildlife and biodiversity to thrive, whilst also having these other benefits around sort of wrapping a sort of a load of greenery around the side of a facade, and obviously that helps with things like glare as well, and also thermal insulation as well, so keeping buildings sort of cool in the summer and sort of warmer over the winter. And yeah, like I said earlier, there's things like rain and water attenuation and air quality as well, which are all sort of part of this, which is good. Here's another example of a green wall or a living wall that we've done in the past, which is at Lancaster Hospital. Again, it's sort of in a sort of reception, semi-open area. And as you can see, there's lots of different plant varieties and plant species there. And the way they're sort of planted up into sort of groups really does help with that sort of habitat creation. And that's one of the reasons why we do it. The other is purely design-led, and it's all around sort of creating that sort of maximum visual impact, as well as all the other things that we're talking about here. Working together is one of the things that we'd like to do in terms of create partnerships with everyone on the call, really. And we are a product supplier, so we would sort of advise and design and supply green living walls for any sort of project, and we're very happy to sort of have further conversations with people if they do have a project in mind. This photo here, actually, funny enough, is a case study from during COVID times, actually, when we provided some living walls as part of the Nightingale Hospital at the Excel Centre in London, and we basically created this sort of green space for doctors and nurses to take out their important work and just create a space that just felt a lot more natural and a place where it would soften the whole sort of landscape and everything else. And I think it was really important at the time, obviously, because I think people are working out of porta cabins and things like that, which was it's a bit horrible, really, actually. And then what happened is once that sort of got dismantled and decommissioned, the plant box system, the living wall system here, got repurposed, and it's now currently at the Bristol Royal Infirmary Hospital in 2020, and in this sort of courtyard space where there's other trees and landscaping as well. It's a place for patients to come out and sort of enjoy it and sort of maybe back up some of the research and studies that I was talking about in Pennsylvania, where you're sort of actually having this sort of measurable health and value impact when patients can enjoy it. Here's a quote from a nurse working on that dementia ward at the Bristol Royal Infirmary, and it basically speaks for itself. I think in terms of the change in sort of behaviour, the change in attitude, the sort of the calming effect, the fact they say they love it and it's the highlight of their week by coming out there is something that, to me, I sort of think, well, you know, we should be doing more of this, and there should be more of it across the estate. So and also within our public and private places as well. And I just think if there was more green and more considered you know, landscaping to, you know, create these sort of habitats for wildlife, you know, and also for sort of the benefits of people and place, I think we'd be in a lot better position. And it's something we're sort of talking to our customers about all the time. So yeah. Another example, this is the same, or another sort of elevation of the Cundy Street project in London. And as you can see there at the top of the page, there are some habitat boxes. And what we do is we sort of integrate those as in amongst the planting to attract some other wildlife. So, for example, depending on the sort of the height of the living wall, we would introduce bird boxes. We would also introduce sort of bug hotels and bee hotels and everything else. And what that does is, you know, create that further habitat for wildlife, and it sort of complements the planting around it, which is really good. Yeah, and just want to say thank you to everyone, and thanks to Georgia for sort of facilitating the whole session. Yeah, if there's any questions or whatever, just yeah, let me know and I'll be happy to help.
Thanks, Matt, and thanks for everyone for sticking around as well. We are a little bit longer, that we're an hour and a half on this session because we've had so much to go through on this, and we still haven't scratched the surface, in my opinion. Thank you, Matt, for demystifying living walls. If there was any mystery for me, you've definitely debunked. And I love the habitat tower as well. It's not something that I've seen before, so that was really lovely. Right, let's get into some questions. You guys have been super efficient and actually have been typing lots of answers away, so I really appreciate that. There was one question though that, Hattie, you've been really helpful and answered, but it just means that other people on the call may not actually see that question, so I wanted to pose it to you live, and I wanted to see if maybe Emma can support us a bit on that as well. And it's about the funding as well, right? So it's about someone trying to find funding to improve their grounds at the NHS off-site building that they manage. Can Emma and Hattie, can you just give us a bit of an idea of where the funding comes from for these kind of biodiversity projects, and how you guys have managed to work with external partners as well? Either of you jump in, don't mind.
I was just going to jump in to say, I don't know, Hattie might have more insight more broadly on this, because my role is quite specific and project bound, and we were lucky enough to work with Northumberland Wildlife Trust, who already had at least a small part of funding secured to run our eco-influencers project. So I guess our point was just to kind of look out for those opportunities, and one of the points of the eco-influencers project, which Liz and Rihanna might be able to say more on, is that the idea is eco mentors support the young people to then look for further budget applications themselves, because the whole project is supposed to be youth-led. So that's sort of our perspective, which might be a little bit different to the question. So I don't know if Hattie can share anything further.
Yes, I wasn't sure what improvements the question was referring to, but I mean, yeah, our funding is through DEFRA, and it's just for trees planting on publicly accessible land. So, I mean, I think their off-site NHS building would qualify for that. So if it's tree requirements, then we kind of have that covered. Otherwise, Plants for Future is an organisation that often have like small funding pots available for plants and kind of perennial plants for community groups. But if they're kind of talking about kind of landscaping improvements, I'm not completely sure. I'd recommend like talking to local firms, and they often do kind of pro bono work, kind of stuff. They might have discounts or something for the NHS. I'm not, yeah, worth checking with your kind of management team and seeing if they have any connections already. Yeah.
Okay, great. Here's a really pertinent one from Timothy, who says that he was once told at the meeting by the head of occupational health department that the biggest stress was the lack of car parking space, and that they should dispose of all green space on the site and make better use of it for it to be car parking. And you know, it is a tough thing to deal with when you're going into a hospital and you're coming to visit someone and you can't get parked, and it's a tough thing. But Timothy's asking, how do we convince higher management that green space is also important? You know, how do we manage those sort of competing priorities between things that are very important, like parking and getting people on site, but also greening? Anyone want to jump on that one, because it's quite a broad one?
I'm happy to give it a go.
Yeah, go ahead.
So yeah, I was thinking that it's annoying how like a flippant comment from someone can kind of stick in your head like that. But I imagine that that's not the feeling of the whole management team. And it's probably worth looking at kind of your site's green plan, because they probably actually have targets which would protect against, you know, digging up green space. But also biodiversity net gain is there to stop that kind of that work's going ahead without consideration of green space. I'm not an expert on biodiversity net gain though, but worth checking. And then also tree equity scores worth looking at, just to like have as evidence that you need to keep your green space. So yeah, worth checking that. But yeah, I think reframing to kind of think about people's interests. So they might not be interested in green space specifically, but they might be interested in the overall image of the site, and like making sure that the image of the trust is good and that they're not pulling out trees and, you know, doing damage that could create, you know, bad press and be bad for the environment. So yeah, those are quick thoughts. Had anything else?
There's also been quite a few people that we've had on our webinars in the past where they've done loads of really interesting things with car parks. You can stick a living wall on a car park, right, Matt? And people have done living roofs, people have done rainwater harvesting, people have done canopies for solar power gen. There's loads of stuff people can do with car parks. It doesn't have to be one or the other, does it? There's different ways to bring those two things together. Emma, you've raised your hand. Have you got some comments on this one as well?
Yeah, I was just going to add on what's been said, really. Like Hattie mentioned, I think it's all about your audience and finding their specific buy-in area, isn't it? And I think a few of the presenters today have mentioned sort of different evidence bases. And it made me think of the Centre for Sustainable Healthcare sort of promotes this triple bottom line approach for improvements, and it's thinking about different aspects. So things like, and in relation to this, it would be evidence-based, I guess. So patients and population outcomes, you know, social benefits, financial, ecological. And I think that can just be a helpful framework to try and get your audience's ears to prick up about what's important to them.
Yeah. There's a question as well here, and I think Gemma, you had, it was in one of your slides, it was a bullet point about biodiversity net gain, and it is something, again, it's one of those terms that's sort of being floated around. I wondered if you could give us a bit of an explanation quite quickly about what that means and about what can be done around that.
Yeah, so basically you've got to show that your site is kind of 10% better than it was previously. And so it's the way it does it is through looking at habitats that are on site. Different habitats have different values, and you also look at how good an example they are of that site, of that habitat. So are they a nice habitat, but actually it's been trashed and not looked after very well? And then so as part of planning now, you're going to have to show that what you're doing overall is better in the end. So yeah, and it's quite a complicated process of filling in lots of spreadsheets and things like that, which is why we get involved in it. It is quite complicated, but the aims of it are that hopefully overall you get a good result. And as Hattie was saying about in the car park example, if they were to create a car park and get rid of the green space, they would have to replace it somewhere else, and they would have to replace it 10% bigger than it was before. So it is, yeah, it's quite complicated. It's very new. It's only come in this year. So there's still a lot of teething problems, people trying to work out how to do it, what to do. But yeah, but there is also, if if you've got someone with loads of land, there is obviously that potential to get some funding for creating habitats on that land if you can sell the credit. So if you're not developing, but you can make a site better, you can create units which can then be sold to somebody else. So for a lot of NHS sites, probably not applicable, but if it happens to be somewhere with a lot of space where they could do a lot of things, then that's another potential source of funding there as well.
There's also some questions on how best to maintain these kinds of ecosystems with small teams and grounds people. Obviously, Hattie has shared links already to the matchmaking service for volunteers, which is a really, really helpful resource. Hopefully you'll be able to get volunteers on site. There's also a lot of private businesses, as we've mentioned before, who do like to get on site and give back for their own ESG reasons. But how about the guys at Northumberland Wildlife Trust? How can people make sure that they're doing the best to keep what they've built and look after those ecosystems? What do you guys reckon?
I think what we always aim to do with our work is make sure that when we're working with people, we're building up the skills along the way, so that when we step back, people there have the skills to keep it going. We've worked with a few different hospital wards, and what we've done there is like we'd like to do the Great North Children's Hospital, is upskill staff, particularly people like activity coordinators, if people are on the ward a lot that do activities with patients and service users, so they are able then to go and continue that work with them. So for example, there's lots of allotment sites near hospitals or internal courtyards that often are actually managed by the patients themselves. So that's probably a good approach to go by. And then also the wildlife trusts have a huge base of volunteers as well. So I think up in Northumberland, we've got sort of over 450 active volunteers, and through various projects that we run, people can access support of those volunteers for green activities as well. So I think it's linking in with your local network, things like green gyms. I think there are an NHS volunteering scheme for patients in some hospitals as well. So yeah, sort of exploring what's around in the space.
Yeah, that's great advice. On our nutrition webinar and our Sustainability Day of Action that we did in July, at Leeds Teaching Hospital Trust, they do have a big garden where they grow their own veg and fruit and everything, and both the staff and patients are encouraged to get involved with that. It's part of their therapy as well, part of getting better, and to take away some like really nutritious, homegrown produce as well is really important. We're going to have to finish because we have actually been on for an hour and a half, and this time is absolutely flowing, and we do have a lot more questions, but luckily a lot of them have been answered from you guys busying away in the background, so I really appreciate your input. I do need to quickly let everyone know of the events that we have upcoming, so thanks again for everyone for coming today. The events that we have upcoming next month, it is Green Building Week next month, so again, we've done this a couple of years in a row. We've got building back greener strategies for building and transforming and retrofitting the NHS estate. If there are any estates managers that have some great case studies of how you've either built from scratch or retrofitted anything into your trust, we would love to hear from you, and we would love to know if you'd like to get involved with that next webinar. Equally, if there are any businesses on the call today who are interested in sharing what you do to support the NHS for green buildings, again, please contact us through the Sustainability Partnerships website. We've then got the month after, always a big one, NHS Plastics, Reduce, Reuse, Recycle. In November, we're looking at transforming hospital theatres. And then in December, as always, we've got the NHS Awards. The NHS Awards are now open. They close in sort of mid-October. So if you are an NHS trust that has done something amazing this year and you'd like to see some credit for that, please enter the awards. Equally, if you are a business who's done something amazing with an NHS trust and you have a case study to share, there are business award categories open there as well. Finally, we have brand new, last month we opened up our NHS Sustainable Suppliers Index. which I will share into the group now. If you are a business that supplies into the NHS with something a sustainable alternative, you can go and add your profile to that, and it means that people within procurement in the NHS are able to just quickly go to that site and find businesses that they can work with who have a more sustainable alternative. So thank you for everyone who's already been involved with that, and let me know if you have any questions. So it just remains to say thank you so much for everyone who did manage to stick out with us for the last half an hour. I know that people have had to leave, but as always, this has been recorded. We'll try and add every single one of those resources, links, case studies, all of the slides, all of the contact details of everyone who's been involved, and the full YouTube watch back video of this session will also be probably the beginning of next week, because we do have bank holiday coming up, and everyone who signed up will be emailed a link to that roundup as well. All right, so thank you so much to everyone who's been involved today. We've already lost a speaker because we're getting right up to the wire, so thanks so much to Emma, Rhiannon, Matt, Harriet, Liz and Gemma, and to everyone who joined us today, and we'll see you again next month. Thanks everyone.
Thank you. Bye.